Hello, everyone. Welcome to our Thursday workshop series. I'm with a raspy voice. I got laryngitis. Otherwise, I'm fine. Sometimes I have this maybe every couple of years, once for maybe 2, 3 days. So by tomorrow, I should be better. So anyhow, and today's topic is very interesting and frequently misunderstood, even in medical fields. And we are going to clear up today what is really going on. What is histamine intolerance and what is muscle activation syndrome or MCAS, or some people even expert call it MCAS, and what is common and what is the difference. Hi, Monica. I see now. So, my new voice. I could not sing for sure tonight. So let's move and give my. Okay. Yes. So, as you know, guys, this presentation is a medical information, it's not a medical advice. And by all means, it cannot diagnose, cannot treat, or can't replace the work or help or your healthcare provider. So, just to know, I like to educate, I like to inspire, because I know when we know better, we do better. That's me. My name is Dr. Ilona Berkoven. I use my middle maiden name is like middle name. When my page was taken down, so I added my maiden name, so it's Ilona Horti Berkoven. I love medicine and studied seriously for 40 plus years, but less seriously for 50 because early on I got obsessed with the human body and I'm still in awe so many times researching and learning complex processes. How everything is so fine tuned and so just amazing. I love what I do. I love my clients and I will not change my life in any meaning. I had a rough path to come here to this point, and I would happily walk it again. So, when I don't work, I like to travel, I like to hike and forage. So, today's objective is sorry for a throat cleaning, it will have to go on and on. So, to understand what is histamine, what is histamine intolerance, right? What are the most common symptoms? What are mast cells and what is the mast cell activation syndrome? So I promise by the time you leave this workshop, you will know exactly what is the difference. So histamine is a chemical messenger, is a signaling molecule, an amine that mediates several cellular responses functions. So when the cell is under inflammation or certain situation like inflammation, stress, allergic reaction, we have histamine. But we also need histamine for stomach acid secretion. One of the means of suppressing stomach acid, which will not be most of the time, is H2 receptor blocking. Histamine has 4 different receptors, and they are throughout the body. We don't need to know what is the difference between receptors and functions. It also acts as neurotransmitter in the brain. Just think about the non-selective antihistamine. What will happen? You get drowsy, yeah, because of histamine suppression. So when people say, "Oh, I have histamine," the forums, the Facebook diagnosis, and so on. I have histamine. Histamine is not a villain. We need histamine for normally healthy functioning body. The problem with histamine is when we have too much. That's the problem. So, and we will learn why is that happening. Now, histamine is stored inside the granules of mast cell. Mast cells are immune cells, the first line of defense, a non-specific immune reaction. So, and when mast cell releases granules, they release histamine. So that is one of the ways. Then we ingest histamine via food. We learn which food is high in histamine, what is low in histamine. So what are in the gastrointestinal tract? We have smooth muscle contraction, a mucus secretion, in the lungs, airway constriction. You remember when people have, for example, anaphylactic reaction, they can't breathe, right? The blood pressure drops because blood vessels dilate. Skin itchiness, hives, and I have a picture of dermographism. Dermographism, you can read on your skin. You read and it will be elevated and red, so you can really read. And anaphylaxis. Histamine, food has histamine, but for a healthy person, it's not an issue because we have the enzyme diamine oxidase in the small intestine, and that will clear the histamine. So for a healthy person, it's not an issue. The issue becomes when we have too much histamine intake, histamine production, and not enough enzyme to clear it. So what happens? So also we have to mention that some of the medications like diuretics, muscle relaxant, PPIs, right, and H2 blockers, painkillers lower the efficacy of the enzyme. Also, caffeine, green tea, the nutrient deficiency, especially vitamin C, B6, and copper, big time can lower the efficacy of the enzymes. And also SNPs, um, the, genetic deviation, right? Genetic polymorphism can lower the function of the enzymes. So, what are the symptoms? And we will learn where the symptoms. Someone else joined us, I can see, but welcome. I hope, guys, again, it's not too bad, my voice. And if I knew that it will be this bad by evening, I will certainly reschedule. This afternoon was fine. So, and you see the overlapping between the histamine intolerance and mast cell activation. So we have brain fog, we have drowsiness, we can have diarrhea or constipation, depending from the person. It can be headache, itchiness, out of nowhere. You don't see anything on the skin and start itching like crazy, hives, low blood pressure, or sometimes even high blood pressure, heart palpitations, fluid retention, inability to lose weight, sneezing, right, flushing. Especially those symptoms are very prominent after meals that are high in histamine. Diarrhea, here is urticaria. Urticaria is what I calling wheals, right? Elevated patches you can see on the skin that move. So once you have the elbow area, next hour you have on your shoulders. So that's and it's very itchy. And this is dermographism, you see, Britain Y. And we can use even as dermographism as a diagnostic tool because you will see diagnosing both of the situation is not that simple. Now, muscle activation syndrome. So this is a relatively new dysfunction. It was described in the 90s. So many mainstream medicine practitioners won't accept it, won't acknowledge it, Some start getting to the point because, for example, when I was in medical school before, that was before the 90s, the only thing was mastocytosis, is a mast cell tumor created by mast cells. So, and this is totally different. So mast cells, as I mentioned, are cells of the non-specific immune response. So when, for example, bacteria enters, mast cell will react because we have the very first line of defense, antigen-presenting cells that will activate the mast cells. Mast cells will get close to the bacteria. That was an example. Can be toxin as well. Release the granules in order to kill the invaders, right? So that's a normal reaction. The problem arises today when mast cells get very, very active and they just can't calm down. You know, let me find an example. Those kids that are having enough of everything and they start crying. And when the parents give, I don't know, toy, they stop crying. Now, in this case, they just keep crying, crying and crying. You can give them all the toys, they can't stop. Similar with mast cells. So when they attack the invader, they should calm down and get back to rest. But the problem is they cannot. Now, why they cannot? Different theories. One is genetic predisposition. The other is very frequently Ehlers-Danlos syndrome, when we have connective tissue disease. That's a genetic, and Lyme disease frequently. So, but not only those two, dysbiosis, SIBO, IBS, right, food antigen, even electromagnetic field. A study was done in Sweden. So everyone here who has issue with mast cells, make sure that you minimize your electromagnetic exposure. You turn off the router in the house. You don't put your phone close to you at night because it can activate mast cells. So frequently I hear from people coming to me or having conversation, I have MCAS. That's okay. But guys, MCAS is not a diagnosis. It's part of something. So diagnosing someone, same with histamine intolerance, is not a diagnosis. Because we have to find out why. It's a big why. Why someone histamine intolerance and why someone has a cell activation syndrome. What is that setup so makes the mast cell so angry, so hyperactive? That's the problem. So bacteria that frequently stimulate mast cells, Staphylococcus aureus, most of the Streptococcus species, Pseudomonas, Enterococcus, Candida, H. pylori. So, and now see the symptoms of mast cell activation: heartburn, difficulty swallowing, indigestion, abdominal pain, diarrhea, constipation, fatigue, muscle ache, nausea, oral symptoms and sores. Very common and a lot of overlap between histamine intolerance and mast cell activation. Now let's see what is the difference. Histamine intolerance, remember, is a clearing problem. We don't have enough of the enzymes. And mast cell activation is a regulatory problem. Two different things. Mast cells do have histamine in their granules. But when mast cells activate, they release the granules, they release histamine and many other, over 200 substances, cytokines, leukotrienes, prostaglandins, tryptase, beside histamine. So, histamine intolerance, remember, low diamine oxidase in the small intestine that degrades histamine. Reason for that can be different. And very frequently, again, they overlap with mast cell activation. Could be gut inflammation. So the inflamed cells are not producing enough enzymes because they are inflamed, they're damaged. Dysbiosis, the SIBO, what can happen? The bacteria will steal the enzyme from us. So we already have not so well functioning cells. Then the bacteria will steal from us because they use thiamine oxidase for their own purposes. Then we need magnesium for functioning of thiamine oxidase. We need copper, but magnesium is one of the most important mineral in this case. And bacteria will also steal magnesium for their own purpose. Shame on them, right? Then we have leaky gut. Then we have medication. Remember, I mentioned the diuretics, the acid block reducers, so on. Estrogen dominance, high histamine food, especially leftover food. Now, many times people won't understand why it's so important not to eat leftover if you have both histamine intolerance and mast cell activation. Normally, in food, we're talking about mostly about protein, meat, right? Meat, poultry. We have amino acid histidine, and the bacteria converts into histamine. And that leftover meat can be a healthiest one, cleanest one, sitting in the refrigerator. But still, this conversation is happening. So that is, we have to avoid leftovers. Again, the mast cell is a regulatory problem. And as I just mentioned, they release histamine and 200 other inflammatory molecules, tryptase, prostaglandins, as I mentioned, leukotrienes, so on. Why? Chronic infections and very frequently underdiagnosed mold exposure, trauma, wire triggers, especially Epstein-Barr virus, CMV cytomegalovirus, is a chronic latent infection that we sometimes don't even know we have. Chemical exposure, nervous system dysregulation, trauma, for example, not only physical, but even emotional trauma, stress, can just like that onset mast cells and hormonal fluctuations. So, how they connect? Histamine intolerance can trigger mast cells. Remember, mast cells have a function to protect. So even histamine that is normally present in the cells, when it's overloaded, right, a huge amount, it can offset mast cells. But also, mast cell activation can make histamine intolerance worse because remember, they will spew out. I have a couple of interesting files you can see. We have two people present. Welcome. I can't see who is that, but happy to have you with my sexy voice. So, most people with mast cell activation have histamine intolerance, but not everyone who has histamine intolerance has mast cell activation syndrome because remember, the histamine intolerance is because we don't have enough enzyme. Huge difference. And both of them are not diagnoses. In both cases, when we suspect, diagnose someone, we have to find out what is behind, why we have overload of histamine, and why our mast cells so angry. You can see here is the mast cell. You see the granules, and here is when they release those granules. And in those granules, we have histamine and 200 other mediators. So here are the triggers: infections, allergies, extreme heat or cold, exercise, stress, odors, perfumes, well known. Did you see people, when you walk in department store, walk like this because they cannot tolerate smells, alcohol, chemicals, and some food. Now, here is the tricky part. There is no specific diagnostic tool to diagnose both of them. Yes, we should measure histamine in the blood, but it's very non-specific. Meaning, if you have elevated histamine, yes, that's a diagnosis. But many times, at the moment of the blood draw, histamine is normal. So that doesn't exclude histamine intolerance, unfortunately. Same with mast cell activation. The golden standard, which doesn't work well, is uh, measuring elevated tryptase. Remember, mast cell, beside histamine, 200 other uh, chemicals, inflammatory, basically. One is the tryptase. So when the tryptase is elevated, that is diagnostic for mast cells. But when we have normal level of tryptase, doesn't exclude mast cell activation because it's very non-specific, very short-lived. Basically, the person should be in the ER ready for the blood draw in the moment of flare. Usually people know a little better. They have script from their doctors and they have flare of mast cells activations. They run to the ER. By the time they do blood draw, tryptase is normal. Of all my clients with mast cell activation, I had one that was cut with elevated tryptase, none of them. And they multiple tests, blood draw or tryptase, every time was normal. So now some labs started checking methylhistamine, and again, the test results do not correlate. Sure, if you have elevated tryptase, it can be diagnostic, looking, of course, with the symptoms. Normal tryptase doesn't exclude mast cell activation syndrome. Same with histamine intolerance. So, how can we diagnose? Poor doctor's diagnosis, which is a very good, detailed health history, asking many, many questions. We can play a little bit with dermographism, but very simple way, especially with histamine intolerance, is to put people on low histamine diet for a week, and they after eat food rich in histamine, for example, avocado. And they know if they react, that's the proof. If they don't react, no reaction at all, with high probability that exclude histamine intolerance. Just hydrate my throat. So, food that are high in histamine, as I mentioned, leftovers, chocolates, fermented food, dried food, processed food, canned, smoked, uh, avocados, tomatoes, bananas, citrus fruit. By the way, of all the citrus food, the least amount of histamine has lime. Many people can tolerate a little bit of lime juice. Walnuts, seafood, shellfish, spinach. Now, guys, when people push, oh my gosh, you just eat fermented food, you will heal your gut. Maybe. But what if the person has histamine intolerance? They won't tolerate fermented food. So first we have to do the foundational work, the calm the system, heal, seal, and then slowly later on add fermented food. Right? Same with bone broth. Just drink bone broth, you will heal your leaky gut, maybe. But again, the person has high histamine levels, won't be happy. The stomach won't be happy, the gut, with bone broth. So here a little graphic. Age, absolutely everything aged. It's high in histamine. Fermented food, the microbiome. So when the gut is healthy, when we have a robust microbiome, we should not worry about food with high histamine because again we can manage it. The problem is when we have, say, when we have imbalanced microbiome, unhealthy microbiome, low diversity, that will lead to damage of the gut lining, maybe even leaky gut, and the whole slew of problems, including inability to metabolize histamine properly. And that can be a problem. Now, what will happen when we have excess histamine? Uh, so excess histamine, we have dysbiosis. Remember damage of the cells of the intestinal lining. And some bacteria per se can secrete histamine. Not the bad bacteria, only the pathogenic, but opportunistic. Even some of the bacteria, lactobacilli in bifidobacterium, that are commensal, part of a healthy microbiome. Hi, Juana, welcome. So, when we have high histamine, we can't stop with the diagnosis. We have to see why, what is happening. Another reason is loss of Clostridia. Now, Clostridia is a huge family of microbes. They have C. diff, for example, the hospital infection, but it can be very dangerous to the Clostridia that are big butyrate producers, right? And butyrate short chain fatty acids are very protective. So in every case of histamine intolerance or mast cell activations, we have to dig deep and see what is really going on. We have to find the reasons, right? Especially for mast cell activation. That can be very tricky, and those people are, many of them, struggling big time because they are hyper reactive. They react to everything, including sometimes, which is can be so bizarre, including to the excipients in medications. For example, you give them cromolyn to calm the mast cells, to really calm the mast cells, and they react to the medication. So they have to go to compounding pharmacy. So I have one client I frequently share with you guys. She was so sensitive. This is crazy. And most of the time they react to probiotic. Yes, even histamine negative. So we started with probiotic drops for newborn babies. The dose for newborn babies, 5 drops. So let me repeat, she's an adult woman in her early 70s. 5 drops is a regular dose for newborns. We started with 1 drop. She ended up in almost in anaphylaxis. It can be very frustrating for the person and the whole family. They never know when can react in restaurant to food, some additive, sometimes a restaurant sneak in some taste enhancers. There are people not aware they can react. So, and also, this is one of the hallmarks of mast cell activation syndrome. You never know when can you react. You can eat a piece of chicken today, but you are perfectly fine. 2 days later, you react. So, and multiple organ systems. That's a big difference between MCAS and histamine intolerance. So, at least 2 organs, for example, GI tract and lungs, or GI tract and skin. So, multiple organ system, very unpredictable manifestation. So, what to do? As I mentioned, diagnosing is tricky, but when we have a good idea, then we dig, we go root cause. Why we have histamine intolerance? Why we have low diamine oxidase function, right? What is happening in the gut? And we just start with basics, gold standard, GI-map, organic acid test, maybe food sensitivities. And then we dig further. We go to diagnose Lyme if we suspect. Then we go and check for mold. Sometimes it really need a broad uh, intervention because we really have to find. And in my client's case, that reacted to one drop in her case was mold. And no one was even talking for years or thinking to test for her mold. Sure enough, from Florida, people from Florida, a lot of hurricanes, a lot of flooding, high problem. It's almost like, are you from Florida? Yes, we do mold testing. Almost, guys. I don't know any one of my clients from Florida we tested for mold. All of them came back positive. Yeah. So we underdiagnosed big time. So what can we do? Stabilize muscle, calm them down. Cromolyn, ketotifen, like prescription medication, quercetin, luteolin, vitamin C, omega-3s, and acetylcysteine, depending from case to case. Usually they have a protocol now. Allergologists work, most of them work relatively well with MCAS. The only thing they calm it very well, but they don't look for the root cause, right? Mainstream medicine. So usually when people put on the protocol, cromolyn and histamine 1, H1, H2 blockers, they are relatively calm. If nothing extraordinary happens, they are relatively calm. Don't try to add many things to the regimen, just bare minimum. And again, start digging what is happening, why. So that's also very important to regulate the nervous system because the nervous system dysregulation can set off muscles. Slow deep breaths, especially belly breaths, humming, gargling. But when you do humming and gargling, it has to be very loud, and cold therapy. So you don't have to immerse into icy water, just splash ice cold water on your face, or even a washcloth. You put in icy water and then on your face. That can calm the nervous system. So cell activation is not a danger, it's a diagnosis. Remember, guys, it's not a diagnosis. We need to dig deep, sometimes very deep and broad, what is behind. And if we can't find any reasons, we have to go to mold, we have to go to Lyme's and co-infections. Those are very, or even genetic testing for Ehlers-Danlos. Usually when people come to me, they say, I'm sensitive to everything. My next question is, do you have Ehlers-Danlos syndrome? And many times, yes, because those people are very complex. They struggle big time. No one is able to help them. And they wander from practitioner to practitioner, still feeling horrible. That level of sensitivity and never knowing when can it hit next time can be very devastating. I invited, I don't know, last year or so, maybe last spring, a young woman who is stable now. She was so sensitive, so reactive. She would get hives on her buttocks by sitting, and she was very skinny, to the point she would get blisters and bleeding. Can you imagine? Horrible, horrible way to live. But luckily now she's fine. So, food low in histamine, non-citrus fruit, fresh meat. Now, I mentioned, guys, bone broth. You can make meat broth. Meaning meat, you cook meat longer than usual as soup and have that. For people with high histamine, mast cell activation, you cannot have leftovers. That doesn't mean you have to cook every day. You cook a big batch and cool it, put it in an ice bath, and right away freeze. That way you are good. Because we really can't cook every day fresh meals. Not all of us, right? Uh, then gluten-free grains. Eggs are safe. Fresh vegetables, except tomatoes, avocados, spinach, and eggplants. Coconut milk, almond milk. So any question for me? Again, guys, I apologize for my voice. If I knew I will reschedule, but I just didn't want to reschedule last minute. So hopefully, uh, you can understand. I will watch my recording, and if I'm not happy, I'll redo it. Let's see. Or maybe just release it for a period of time. And when my voice is back to normal, I just redo it. Let's see. But I'm willing to take your questions. Or if you watch the recording later on or this live later on, feel free to post questions underneath, tag me to make sure that I will see the question. If no more questions, I will close this session. Yes, I have a big thank you for everyone. So far, I can see Monica and Juana. I can see two other people. So sorry for that. And let me stop the recording.